Alright, my name is Ahmad Akawaga, and today I'll be doing my informative speech about Alzheimer's disease. Alzheimer's disease is a progressive degenerative disease of the brain. It has to do when the nerve cells get destroyed and it ends up impairing a person's mental functioning. Alzheimer's disease is currently the 6th leading cause of death in the United States and the 5th among people over the age of 65. There's currently 5.2 million Americans being affected by it, and more than 8 million around the world. How Alzheimer's disease affects the body. There's really two mechanisms that cause it and cause its effects. The first is plaques, and that's on a microscale level when little bits of protein end up getting in between the nerves and end up reducing the amount of levels of the chemical messengers, and that ends up stopping the communication between the brain and other parts of the body, and it disrupts cognitive function. The other part is more structural. They're called tangles, and they end up disrupting the flow of nutrients throughout the neuron, and this eventually the combination of the two eventually leads to the neurons dying and shrinking of brain tissue. There's currently 3 stages of Alzheimer's. There's the preclinical Alzheimer's, where you can see some measurable changes in blood, cerebrospinal fluid, and brain structure. Mild cognitive impairment, and that's when there is some changes in thinking ability, and then dementia due to Alzheimer's, where it impairs a person's ability to function in everyday life. And on these little MRIs and all that, there's a normal brain, and you can tell there's not really much darkness around here. The darkness indicates dead brain tissue, dead neurons, mild cognitive impairment, and fully affected by Alzheimer's disease. And when you get to that point, it's affecting your everyday life. Alright, what factors cause Alzheimer's disease? Alzheimer's disease has been proven to have some genetic linkage. The gene that's correlated to it is the APOE4, and it's said that inheriting 1 copy of it raises a risk of developing the disease by 4, and with 2 copies the risk is increased by 12. There's also environmental factors. Studies have shown that severe head injuries and lower education levels can influence a person's risk of developing Alzheimer's at a late age. Some of the risk factors affected, age is obviously the big one, and I think it's 80% of Alzheimer's patients are above the age of 65. Women also have a higher chance of developing Alzheimer's due to the fact they live longer. Family history goes with the genetic correlation. It's also been shown that having other heart and vascular disease as well as high blood sugar can affect a person's risk of developing it. Alright, the majority of the symptoms of Alzheimer's disease, since it is a nervous system disease, is that it does deal with your cognitive activities such as planning and solving problems, understanding visual images and spatial relationships, trouble speaking and misplacing things, and some mood and personality changes. Alright, there's many ways that you can diagnose a person with Alzheimer's. The first is by looking at a medical history, and that's not really a primary form of diagnosis. It just has to do with analyzing their risk and to see if they have any other causes of their dementia. Physical examinations can be used to check reflexes and coordination. Lab tests are usually done on urine, blood, and spinal fluid samples. There are some cognitive tests, such as attention, memory, and perception exams. And then obviously, as I showed before, there's MRI, PET, and CT scans that can be used to diagnose it. Treatment of Alzheimer's, you can use medication. There's 2 really ways that you can use the medication. That's by trying to treat Alzheimer's directly, and you can use cholinesterase inhibitors and NMDA antagonists. The other way of treating Alzheimer's is you can treat the symptoms that accompany it, and you can use antidepressants, antipsychotics, stimulants, and sleep medications. Physical therapy can also be used to improve coordination, and then there's also cognitive therapy, which can also go along with psychological therapy. That's really all I have. The importance of Alzheimer's is that it is really common in older people, so it's real it's a high risk that either you or someone that you know will be affected by it, and there's really no way to really prevent it, but educating yourself on it will help. And thanks for listening to my speech.